As I said in the intro, I've been meditating for 20 years and I just can't imagine a life without meditation. And I think if the whole world's population meditated, we wouldn't have all the enormous problems that we have at the moment. And I'm absolutely delighted to say that in the studio live, we have Professor Robert Schneider, who's the Dean of the Medical Programs at the Maharishi University in Iowa, and he runs the Institute for Natural Medicine and Prevention, and he's also the author of a magnificent book, Total Heart Health, and we'll find out a bit later on in the interview how we can get this book. And if anyone has any questions about meditation, please ring in now on 13 13 32. Good evening, Robert.
Good evening, Ross.
Now, look, thank you so much for coming into the studio. It's a real honour for us to have you here, and it's an honour for us to have you here in Australia. So what are you actually doing here in Australia?
Pleasure to be here. Well, I was invited by several Australian medical organizations to speak with them about the latest discoveries about mind-body medicine, particularly related to heart health. The news from America is that the American Heart Association has reviewed all the published scientific literature on meditation, relaxation, stress management, and high blood pressure, and they concluded that meditation, in particular transcendental meditation, is effective in lowering blood pressure, and data shows it also reduces heart attacks, strokes, and death.
Is it more effective for blood pressure or more effective for just straight-out cardiovascular disease, or a bit of both?
Well, there are 11 published studies showing, on average, substantial reductions in blood pressure. So that has the most data behind it.
By about how much?
On average, 5 millimeters systolic.
Now, that mightn't sound like a lot to people listening, but the average blood pressure pill, you'd be lucky to get 5 to 10 millimeters reduction in blood pressure as well.
It's true. Many single medications have that effect. And also people who have mild hypertension, that may be enough to avoid taking medication.
Yeah.
And there are people who have a pre-hypertension, who have high blood pressure, for whom medications are not recommended. And for them, this form of non-drug treatment should be very effective.
And I'd like to throw on top of that all other lifestyle factors as well, having regular exercise, getting rid of belly fat, keeping away from salt, keeping your alcohol intake down, and managing other stresses in your life. And if you throw what I think to be the best stress management technique on the planet, i.e. meditation, you really bring your blood pressure down.
That's true. And the next set of data shows that helps you live longer and stay out of the hospital.
Okay, we actually have a question for you. We have Kerry on the line. Kerry, your question for Professor Schneider.
Oh, good evening. I'd just like to ask how I get back into meditation. About 25 years ago, I learnt to do your meditation in Manly, and I used to meditate beautifully, and I stopped for whatever reason, and now I can't get back into it.
So what do you say to Kerry?
Oh, it's very easy to get back once you've learned. There's a simple checking procedure available at the Transcendental Meditation Teaching Center here in Sydney or other cities in Australia.
So if they get, what website can they go to?
tm.org.au.
Okay, so they can go to that website and get these numbers.
Get the phone number, come in. It's a 20-minute procedure. It kind of gets you back into the whole effortless, natural, effective practice.
Thank you so much.
Okay, good on you, Kerry. That's fantastic. Now, this goes to the next question here. Are all meditations equally effective? So there are many roads into Sydney. Once you're there, you're there. So.
Right. That's true. There are many practices. Some involve a lot of concentration, hard work. Some involve mental activity of observing your thoughts and mind and sounds in your environment. This kind of meditation is different from other practices. It's effortless, no work, and you experience silent inner wakefulness and deep rest in your body, restful alertness. EEG studies show there are different brainwave patterns with different forms of meditation. It makes sense. You're doing different things with your mind. It has different effects. And the cardiovascular studies show, according to independent review by the American Heart Association, that this transcending form of meditation is the only form that has sufficient data to show that it lowers blood pressure.
And it also appears to me that TM's probably been the best studied form of meditation as well.
Overall, in terms of range of effects on mind and body, it has the most studies from most parts of the world, 5 million practitioners worldwide with clinical experience.
Okay, well, I've been practicing medicine in Australia for about 30 years, and some of the things I've said have been a bit out there, and often my reception from some of my more conservative colleagues hasn't been that great. So what's happened with you since you've been here?
Well, we've been to the leading medical schools here in Sydney, and we're traveling to Brisbane, Canberra, Melbourne.
Thank goodness you called it Brisbane and not Brisbane, which most of you... Yes, yeah.
My Aussie colleagues that coached me ahead of time.
That's good, yeah.
The top medical centers in the country have invited me to come and share with them this knowledge because, it's happening now in the top medical scientific circles. This is news, scientific news.
Yeah, and I think it's important that people do realise one of the problems with medicine is there's the comment, if all you have is a hammer, everything looks like a nail, and the only hammer we have is a prescription pad or a scalpel, and it's so important to realise there are other therapies you can offer your patients.
There are, and many people don't like to take pills for their high blood pressure, side effects, cost, and it's if with all due respect, it's a bit disempowering. With this technique, it's sort of healing from within, using your body's own self-repair mechanisms to deal with the cause of high blood pressure, which is a disorder in the cardiovascular balance, in many cases, which is related to the brain. So balance your brain, balance your heart.
Yeah, and so if somebody's listening, what next steps would you recommend to them?
Well, when we're talking to the medical schools, we're saying, look, doctors should learn this themselves, medical students should try it out, and they should recommend this for their patients as alternatives. And if you have high blood pressure or if you're just a regular person, you can look up on the website and try it out for yourself.
You see, the interesting thing is that say for example, a statin drug to lower cholesterol, and I often talk on the show about my concern about the excessive use of statins. There are 16 million prescriptions at least written every year just in Australia for statin drugs, and I would suggest probably 500,000 of those are necessary. And the reality is that would lower your risk for a heart attack, one disease, by about 20 to 30% with a significant potential for side effects. You're talking about a technique, transcendental meditation, that probably reduces your risk for cardiovascular disease close to 50% with no side effects.
That's true. There was a fairly large study published in the American Heart Association's journal, Circulation, Outcomes and Quality. Came out last year. Showed, just as you say, a 48% reduction.
Well, it's pretty close.
Over 5 years, approximately 50% in death, heart attacks, and strokes in people already taking conventional medicines, but one group was meditating, the other group was control. So this is like discovering a whole new class of medicines, but using the body's own internal pharmacy without side effects, without additional costs from drugs, and with positive side benefits.
And I have some people say to me, I haven't got time for meditation. Well, I say to them, well, you're a long time dead, really. So if you spend a half an hour, 40 minutes a day meditating, that's 40 minutes of your day that you're adding so many more years to your life. But it's also not just about the health benefits. I also think it's about the way you feel generally, the way you think, the calm in your life. To me, it's just I just cannot imagine a life without meditation.
Right. Some people call it an essential state of consciousness for health. There's waking, dreaming, and sleeping, the usual states of mind, body. And then people say this experience of restful alertness is as important for optimum health and well-being as the other three states. We've forgotten about it or didn't know about it, but now we're rediscovering this technique for modern times.
See, I just think what you're saying is extraordinary, and I just wish people listening tonight would say, look, I've got a health problem, or I'm very healthy, but I want to stay healthy. I want to learn this technique. I've got to learn this technique. So how do people go about it? We've already mentioned the website. Let's do it again. So it's
tm.org.au.
Okay, so tm.org.au.
And the course is a 7-step course over 5 days, about an hour and a half a day, and then you have personal and small group instruction. In person, it's got to be with a trained, certified teacher. Yeah. And then you learn according to your own rate, according to your own experiences. Then you have the technique for the rest of your life.
And can I tell you my own experience? I learned 20 years ago, as I said, and the first 6 weeks I thought, what am I wasting my time doing this for? I actually felt more anxious meditating for the first 6 weeks. But then after that, there was a total change in how I felt. So I just persisted because I am an anally retentive neurotic. So I persisted at this.
Right.
And after 6 weeks, I've never looked back. 20 years been doing it.
Most people in our studies reported benefits right away within the first few days and few weeks. There are a few exceptions among the medical profession.
Yeah, that's right.
But in that case, some people, when they're involved in self-repair and restoring balance to the system, sometimes in a few cases there can be some turbulence or smoke in the beginning, but then that rapidly clears with this deep rest process.
Yeah, that's fantastic. Now, I want to finish off by also talking about your book. It's Total Heart Health.
Yes.
So if anyone would like to purchase the book, I'm presuming Amazon?
It's Amazon. It's available from all the online booksellers.
As an e-book as well?
It's on Kindle, yes.
It's on Kindle. Oh, that's fantastic.
Yeah.
So it's called Total Heart Health by Professor Robert Schneider. It's probably Dr. Robert Schneider
that's right.
on the book. And look, to me, all of these things, Transcendental Meditation, your book, Total Heart Health, all essential stuff. So it's tm.org.au. Professor Robert Schneider, I'd like to thank you so much for coming in and talking with us tonight.
Thank you, Dr. Ross Walker. It's been a pleasure.